This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
All right. Welcome back, everyone. The coveted post-lunch presentation where we all just get to sit and digest and try to stay awake. We've done our best to keep this interesting. We've got 3 presenters that are going to do shorter presentations, kind of quick bursts on their areas of expertise. And the first group is the students from Lincoln High School FACT. They're spreading the truth about tobacco. So we'll have Kayelyn, Schulze, Jackie C., Savada, Kasun, and Madisyn Hasenohrl. Come on up here, ladies.
Good afternoon. I'm Madisyn Hasenohrl, and this is Savada Kasun. We're freshmen from Wisconsin Rapids Lincoln High School. Our presentation today is on vaping and the concerns. We presented this to a club called FCCLA. Now we are going to nationals in California. Our presentation is called Stop the Vape.
Our concern with teen vaping is that it is now on the rise and is now an epidemic. Our goals with this presentation include to raise awareness to the facts and dangers and to present strategies to help stop and or prevent the start and to share healthier alternatives to vaping.
What is vaping? Vaping is the act of inhaling and exhaling the vapor produced by the heated nicotine liquid of an electronic cigarette, vape pen, or personal vaporizer.
This is how vaping is related to relationship to family and consumer sciences and related careers. Addiction to nicotine negatively affects families with young children and teens. Community education programs will now be needed for parents to identify and understand the warning signs of addiction and risky behaviors. And more healthcare professionals will now be needed to treat people with addictions and diseases related to nicotine use.
What are the risks to vaping? The nicotine is addictive, and sometimes the kids don't even know that they are addicted. And brains are still developing until the age of 25, so addiction makes it hard to cope with social situations and the pressures of life. And it's also a gateway to other things such as drugs and alcohol, and it can affect the way that kids focus in class.
More risks to vaping causes lung irritation. It could also damage the immune system cells. It increases heart rate and blood pressure and also overloads your body with dopamine.
We interviewed our school police officer, Officer Oliveras. Here are just a few of the questions that we asked. We asked how many students in the school vape. He answered 40 plus students cited with e-cigarettes since the beginning of the school year and since when we did this presentation, which was in October. Now, since last week, there has been 98 students cited with e-cigarettes. How do students get a hold of e-cigarettes? He said, from another friend who stole from a parent or older friend, online, or some stores don't even ID.
We also asked Officer Oliveras, on average, how many students do you catch with e-cigarettes? He says he catches 2 to 3 students weekly, or he has to talk to them about it. And how do you enforce the consequences of vaping? They give out citations, and citations are $68.30, and all of this money goes to the City of Wisconsin Rapids Ordinance for Tobacco Products. And if it seems like an ongoing problem and happens over and over again, then that student will get a referral to Human Services.
We have 2 videos. Our first video ties into vaping because it shows you how addictive nicotine can be.
Vaping can deliver nicotine to your brain, reprogramming you to crave more and more. Don't get hacked.
Our second video is on all of the harmful chemicals in the vape juices.
Escape the vape. Escape the vape.
Formaldehyde.
Diethylene glycol.
Propylene glycol.
Nicotine. Diacetyl.
Arsenic.
Cadmium. Fluorine. Aluminum. Lithium.
Rubidium.
Lead.
Do you think the vapes are really just water?
For more information, visit safeinnorthernmichigan.com.
Stop vaping strategies. You can find healthier alternatives to vaping, like exercise, sports, and hobbies. You can find something else to fidget with other than the vape itself, like having a pencil in your hand. And you could also get involved in school clubs like FCCLA or FACT.
These are many different kinds of vapes, and they all range from different prices. And
Throughout our research on this topic, we feel it's important to stop the vape because addiction to nicotine and other drugs can affect the brain negatively, making it harder to handle the everyday pressures of life. There are too many bad side effects to vaping for teens, families, and communities. There are many other things to do in your free time to help you live a happy and healthy life.
Hello, I'm Jacqueline C., and today I'll be talking about what FACT is and what our FACT group has done. So what is FACT? So FACT is a youth-led advocacy group, and we basically just advocate to the community and peers in school about the dangers of smoking and the use of e-cigarettes. We mainly advocate to peers in school, so they're more likely to listen to what we have to say compared to adults to give like a different perspective on these. We also do factivisms, which is basically a way to advocate through interactive activities. And for some of these factivisms, we've conducted cigarette butt cleanups, so we'll go around in a certain area and pick up cigarette butts and put them in a container. And this really just shows how much cigarettes are in our environment. We also have scratch-off cards, which are basically cards that they basically tell you about what life you are living due to the impact of tobacco. We've also done meetings with legislators and higher-up people. So we've met with Katrina Shanklin, Mayor Verwink, and our principal, Mr. Rasmussen. And with our meeting with the mayor, we basically touched on how we think that the consequences should be more harsher because the students at school aren't taking these consequences as well. And like the fines are only like around $60, and we feel like they just think it's just $60 and they can just pay it off and be done with it instead of like a higher amount, which would probably produce a better effect. And then we also had a meeting with Mr. Rasmussen about how we, as a FACT group, can help to stop this problem. Lately, there's been an increase in Juul usage in our school, especially. So it's been to the extent that they've had to limit the amount of people in the bathrooms. And we recently, this year, got more stalls, so all these stalls are not being used for their purpose because there's only 2 people that can go in at a time due to this cause. So it really has impacted our school and the students in it. We also do parades with a banner. We also do posters just to talk about how these harmful effects can come from tobacco and electronic cigarettes. We also write letters to the editor. This could be about our cigarette butt cleanups, just to show our community of what we've done as a FACT group and how important this is to schools and how this really impacts peers in schools. This year, we recently did a Vaping and Smoking Awareness Week just to demonstrate a bigger visual for peers inside of school. This was done during lunch, and we had a little booth with factivisms each day, and we also had posters. So this was mainly just to focus more on e-cigarettes, especially with juuling, because of the increase of juuling. During this week, we've also done factivisms, such as we made a poster. I'll show it later in a picture, but we made a poster, and this had a penny jar fine visual. So we had 2 jars filled with pennies of the amount of fine that you would receive for being caught with a juul or vape. And then we also had another poster which basically compared the amount of nicotine in a juul pod to cigarettes to show how similar they are, which is like 1 juul pod is basically the same amount as 1 pack of cigarettes. And then we also did the scratch-off cards, which I touched on earlier. And then we also did a Jenga game, which is basically we put facts on there and then played Jenga. So the kids would just play Jenga like how they normally would, and they would read off the facts. And a lot of people that came up to our booth were actually pretty surprised about the facts that were on there that they didn't know about. And then we also had information how to quit smoking on the posters as well as like a resource. So this is just some of the pictures that illustrate what we did. So in the far left corner, that was our booth, and we had our 2 posters there, and then some of our factivisms that we did. And then to the right of that is a block from the Jenga game with the fact on there. And then we just had a whole bunch of kids come up and participate in all these. So then these 2 pictures right here are the posters that we used for the booth. And these basically just told our peers about what is in tobacco or the cigarettes and electronic devices. And then that's the penny jar visual. And then we recently had a cigarette butt cleanup on May 21st. And this was originally a cleanup day for our school to pick up trash, but we managed to turn it into a cigarette butt cleanup because we found quite a few cigarette butts on school property by the hockey rink because they have games there, and so that's where we got cigarette butts. And then if you want to find out more about FACT, you can go to the website factmovement.org, or you can also visit www.lung.org. Thank you. Is there any questions?
How I don't like to use the microphone. How are you received by your peers? Do kids act respectful? Do they ask you a lot of questions?
Yeah, I feel like more peers are more comfortable with asking us questions because they might be intimidated by more adults. So I really feel like that they react better with us telling this information from our perspective as well.
Do you think that you got anybody to quit by helping them with the information you give them?
Yeah, I actually do know one girl. She told me that she was trying to quit smoking, and I thought that was like a really good idea. I told her that was a really good idea and that it'd really help her with her health especially.
Thank you.
How hard was this to get started in your school, and what difficulties did you encounter trying to get this started in the school system?
Well, it's actually kind of hard to recruit because some people just think it as a joke and that this isn't really important. But once we got people just to participate in some of these activisms, they soon, like as they went on, they soon realized how important this matter actually is. And I think they started realizing how important this is and that this needs to be done. Any more questions? Thank you.
Thank you. Great job. It's great to see what you guys are doing in the school. And I don't know about anyone else, but that Jenga idea is a good engagement strategy next time you're doing a booth somewhere. And Kayelyn and Jackie will be on the panel later, so if you have any questions as well, you can write those down and ask them. Next up is Darcie Warren. We heard from her earlier in the policy presentation, and she's going to speak about the Partnership for Tobacco-Free Wisconsin.
Thank you. Let me just pull up my slides here. Okay, so yes, you already heard from me once, but so the two parts of my job at American Lung Association, one is to provide the trainings and technical assistance around policy, so that's more of what I talked about this morning, and then the other half of my job is to coordinate a statewide tobacco prevention coalition called the Partnership for Tobacco-Free Wisconsin. That's more what I'll be getting into in this short presentation. So I am really happy to be here today and to have this time set aside to talk about the Partnership for Tobacco-Free Wisconsin. Thank you, all of you, for attending today and the Marshfield Clinic for hosting us. There is a statewide coalition to work on statewide policies that can solve some of these tobacco-related problems that we still have in Wisconsin. And we're made up of many different types of organizations. The American Lung Association, American Heart Association, the American Cancer Society, Cancer Action Network, and many health systems and other kinds of organizations and individuals can join as well. So the Marshfield Clinic is a very welcome partner to have in this coalition as well. So one thing I'm gonna say several times during this presentation is that we have a problem with the level of funding here to address these issues. In Wisconsin, we're only funded at $5.3 million. And again, that's less than 1/10 of what the Centers for Disease Control recommends to adequately fund tobacco prevention in our state. And the healthcare costs and lost productivity that tobacco is causing costs $4.7 billion. And just a couple key things I wanted to make sure to say. One is that some people have heard of the Master Settlement Agreement that has to do with tobacco prevention and control. Other states like Minnesota fund this programming, fully fund this programming at the CDC recommended level by using that Master Settlement money. Unfortunately, in the early 2000s, our government chose to fill a one-time budget hole by cashing in all of that money. So we don't have access to the master settlement, and in fact, we're paying it back in bonds. So every budget, they have to decide how much they want to pay back for that master settlement. The other thing that I hear a lot from folks is well, where's the money going from the cigarette taxes, right? We tax cigarettes above and beyond regular sales tax, over $2.50 per pack, actually. But that money all goes to general purpose revenue in our state. It's not directed at all. No tobacco taxes are directed towards public health or prevention funding in our state. So that's something that other states have done to make sure that they have that funding available, but our government has chosen not to do that. However, there's no shortage of investment by the tobacco industry, right? I mean, we've heard that over and over and over again from all of the speakers today. They're targeting our kids with candy flavors, all these new products, cheap prices, and it's actually leading to lifelong addiction. So I don't need to go into this in depth because all of the speakers have talked about it, but this is the Juul, a little bit more of a close-up if you didn't come and look at the officers' components earlier. This is candy and fruit flavored, the little pods, and it has grown in popularity so much that some kids are even calling this juuling, right, instead of vaping or e-cigarette use. And this is part of the reason why the FDA has said this is an epidemic among our youth. Wisconsin follows the national trends. So we know here in Wisconsin, we've seen a 272% increase with middle school use of these products to 4.1%, and that's from 2014 to 2018. And high schoolers, we've seen a 154% increase to 20%. They come in a variety of shapes and sizes. Again, we've seen this many times, so I don't need to go into it in detail, but the discrete nature of these products and how they're connected to new technology and social media. Kids are sharing videos on Snapchat of how to use the products, how to hide the products, and it's just, you know, it lends to this prestige associated with these products. And some are actually not discrete at all. Some produce huge clouds of secondhand aerosol. Everyone has the right to breathe clean indoor air, and that includes air that's free of this secondhand aerosol. E-cigarette aerosol contains cancer-causing chemicals, benzene, formaldehyde, nicotine, chemicals I can't pronounce. I'm not a toxicologist, right? I'm a political scientist, okay? So what we know is that these products make the air unsafe. And actually, as I spoke about earlier today, many communities are moving forward with policies to incorporate e-cigarettes and vaping into their smoke-free workplaces ordinances. E-cigarette aerosol is not harmless. We don't have that much research, but we do know that it contains ultra-fine particles that are very new technology. So there's actually more particles in a cloud of secondhand aerosol than come from cigarette smoke. So although the air pollution is different, it's not safe. And we know that these ultrafine particles can exacerbate asthma and other respiratory conditions. They constrict arteries that can cause heart attacks. Short-term exposure can cause eye and throat and airway irritation, and long-term inhalation can actually cause children to develop asthma. So we know that in Wisconsin, sales fell to underage folks from 7.1 to 5.8%, and that's a huge victory. We did hear earlier that in Marathon County, that rate is higher than the statewide average. You can look up on that Wisconsin Wins website what your county's rate of sales to youth is. But across the state, you can see the sale of e-cigarettes is significantly higher than cigarettes. And other products are also higher, like little cigars and smokeless tobacco. So I talked earlier, and I just want to reiterate, that products like e-cigarettes and little cigars can be kept in front of the counter. And cigars and e-cigarettes have a much lower taxation rate than cigarettes. So cigarettes are taxed by pack. Little cigars are taxed by weight, and so they can actually be sold in packs of 1 or 2 or 3, and sometimes these can cost even less than $1. I'm just going to reiterate the information about preemption from earlier too. So actually, taxing and licensing retailers is expressly preempted in Wisconsin law. That means no local action can occur in these areas, but the state could change these taxes or require e-cigarette shops to be licensed. Right now, vape shops can open without any kind of license. They don't need to pay the tobacco retailer fee unless they're selling other tobacco products. So vape shops are not taxed, they're not licensed in our state, but that could be changed by policy. An increased tax on brown cigarettes, I mentioned earlier as well, but Governor Evers is including an e-cigarette tax on brown cigarettes in his version of the budget. But it doesn't seem like that specific tax, at least that amount, is acceptable to the state legislature leadership. There's also an e-cigarette tax in Governor Evers' version of the budget. And again, that doesn't seem like something that the state legislature is going to accept, at least not that version, possibly a reasonable e-cigarette tax, but we don't know what that reasonable word means just yet. So we've seen some significant gains here in Wisconsin. Just recently, the adult smoking rate went from 17% to 16%. That's a huge victory. And there's so much really good work that goes on with the Wisconsin Tobacco Prevention and Control Program. Many of the people who have spoken today are funded through that program, right? But since the state only dedicates $5.3 million and less than 1/10 of what the CDC is recommending, we just can't anticipate that they'd be able to do everything that would be possible if they were funding the program at that adequate level of $57.5 million, right? And Governor Evers did include in his version of the budget a $3.3 million increase for the program, but it's tied to Medicaid expansion. For those of you who are following this, you may know that Medicaid expansion was stripped from the legislature's version of the budget, but we have heard that it's possible that specific Department of Health Services increases in funding could still be included, even if it isn't coming from the Medicaid expansion. And so on the table right now, as we understand it, the legislature's Joint Finance Committee could choose to decrease the program even less than what it's funded now. That's one of the options they could choose. They could keep the funding flat, even though we're seeing this huge epidemic with youth e-cigarette use across the state. They could increase the program $3.3 million, even not attached to the Medicaid expansion. They could just find the money some other way. Or we've also heard that they're considering a $5 million increase. So all of those different options come from different legislators, and that's why they're on the table. So obviously, we all know after today that tobacco is still a very serious problem in Wisconsin, and nicotine addiction is going to remain a problem with this new generation addicted to e-cigarettes. I want to highlight a couple of the key tobacco-related disparities that exist in Wisconsin. So education really predicts whether someone's going to be a smoker. If you have a 4-year college degree or more, you're only smoking at 6.4%. People with less than high school education are smoking at 30%. So that's a huge gap, right? And so we call that a tobacco-related disparity. Similarly, folks at the lowest income brackets, less than $15,000 a year, are smoking at more than a third of the population in that income bracket smokes right now. If you're making over $35,000 a year, then it goes down by half. I mean, this is a significant tobacco-related disparity that at this point we're just having trouble keeping up because of the level of funding. There's other disparities as well. So when you look at urban versus rural folks in Wisconsin, tobacco use in rural areas is 20%, smoking is 20% in rural areas, 18% in urban areas. And keep in mind, the statewide average is 16%. So whether you're urban or rural, you're higher than the statewide average. So you can then think, oh, the people living in more suburban areas smoke at a much lower rate, and that's pulling that number down, right? And another one I wanted to highlight is the disparity between smokeless tobacco use. In the rural areas, it's twice what it is in the urban areas. Other disparities exist too. Native Americans smoke at more than double the average rate, and the smoking rate of African Americans is almost as high. And again, this graph shows that those on Badger Care smoke at 29%, again with the income related. People ever diagnosed with depression, almost 30%. The lesbian, gay, and bisexual community, 26% smoking rate, and the Wisconsin and US rate are currently 16%. So public health professionals working across the state would love to better address this issue. It's just not possible with just 1/10 of the funding of what's recommended. Not to go on a tangent or off script, but I worked in tobacco control 10, 12 years ago when we were doing the campaign for smoke-free workplaces. At that point, all of the local health departments got grants from the Wisconsin Tobacco Prevention and Control Program. The difference in capacity then till now, because what happened was there was a significant cut from $38 million, I believe the number was, down to its current level of $5 million. And that cut happened during the Great Recession. Now, it hasn't gone back up, right? So we have these multi-jurisdictional coalitions, folks like Jenna, who is responsible for 3 counties instead of just 1 county back in those days. And so there's a significant decrease in capacity when funding levels plummet like that and do not recover. So we in tobacco control have the benefit of established organizations working in this area. The statewide coalition, Partnership for Tobacco-Free Wisconsin, is housed within the American Lung Association, so that's where I work. I'm happy to work with you to solve these problems. And there's other organizations like the American Cancer Society, Cancer Action Network, and American Heart Association. All 3 of these organizations have experts in policy, PR, and marketing, and we see ourselves as partners with people who want to make a difference. And we also have huge amounts of volunteers throughout the state and employ lobbying staff. So these people are very willing to work with policymakers on solutions to these problems as well. Another important partner is the Tobacco Control Legal Consortium at the Public Health Law Center. So this is a national organization that just happens to be located in Minneapolis, and we work closely with them to make sure that policies that are moving forward have the language that's necessary to be strong policies and not lead to lawsuits. So we're in constant communication with all of these groups, and we're available to support local partners. And that is all I would like to say about the statewide coalition today. I think do we have some time? Do we have some time for questions? Excellent. Are there any questions? Yes. Yeah, so the question is, how can we help the local coalitions to convey a message to the lawmakers to try to change the level of funding? So I have restricted funding. So when it comes to asking lawmakers to increase or decrease the funding, I can't do that. Any of us as individuals on our own time can contact and should get to know your legislators and make sure that they understand this is an issue that's important to you. And it's possible for many of the organizations associated with the statewide coalition, Partnership for Tobacco-Free Wisconsin, who don't have restricted funding like I do, to make those direct asks of the lawmakers. So the statewide coalition would like to see that $3.3 million increase in the budget. whether it's tied to Medicaid, whether it's by itself, that would be a significant over 50% increase in the funding to try to inch back up to that amount. So this is not a huge ask. We're not saying the CDC recommends, $57.5 million. We're at 5.3 right now. We need to add 10 times the amount to this program. We're hoping to increase it $3.3 million. That would be a huge capacity increase across the state. So that would be, making sure you maintain that relationship with your legislator and make sure they know this is an issue that's important to you. Mm-hmm, mm-hmm. Right. So I very much encourage you to sign up for the statewide coalition. So if you go to Partnership for Tobacco-Free Wisconsin, it's tobaccofreewisconsin.org, not partnership, just tobaccofreewisconsin.org. There's a Join Us tab, and you can put in your information. So I maintain the website and that list, but the folks that lead the more lobbying efforts that you're talking about, where if one of these bills comes up or if there's a movement in the budget, we do have folks who can use those lobbying capabilities that will send talking points out like you're asking for, so that you can take those actions. Partnership for Tobacco-Free Wisconsin, so it's tobaccofreewisconsin.org, and then join us to become a member. I'll also leave a stack of my cards down here just in case you didn't write it down quickly enough. Other questions? Yes.
So you're saying like I'm public health and I'm also part of the Northwoods Tobacco Coalition. We can't ask the legislators, but we can get private citizens to ask.
That's a great question. So that's considered grassroots lobbying, and it's actually the exact same thing as lobbying. Okay. So that's restricted as well. I don't know what your funding is, so you might not have that restriction. I have that restriction because of my funding sources. But some of the people involved in the coalition do not. So you might not. You can be a government employee and have some unrestricted funding. So it's sort of a minutia. I won't get into it, but it's one of the things that I do trainings on. So absolutely, doing the education is usually the public health component, and then usually there are partners like American Lung Association, the Cancer Society, Cancer Action Network, the Heart Association, Marshfield Clinic, who have lobbying staff who can take that next step of doing that ask or asking others to do the ask.
Okay.
Mm-hmm. Absolutely. So the question was, what can we do on our own personal time? On your own personal time, I encourage you to keep a relationship with your legislator and make sure they know what information is or what issues are important to you. And anyone who works in healthcare, public health, and understands tobacco-related illness still is the biggest killer. And understands what's happening with e-cigarettes, especially after today's presentations. I would expect when you're talking to your lawmaker would want to talk about those issues. Any other questions? Well, thank you so much again.
Thanks again for that information, Darcie. Glad that you were able to join us today. Our final presentation before the Q&A panel is by Alex Peeters. She's with the University of Wisconsin Center for Tobacco Research and Intervention. Alex is the Northwestern Regional Outreach Specialist for the University of Wisconsin Center for Tobacco Research and Intervention, or UW-CTRI. Based out of Eau Claire, she serves 27 counties in northwestern Wisconsin by providing free training and technical assistance to healthcare systems, clinics, and hospitals on treating tobacco use and dependence. Please welcome Alex.
Thank you, everybody. I just have to get my PowerPoint pulled up here real quick. Right. So my name is Alex Peeters, and I am the Northwestern Regional Outreach Specialist at the UW Center for Tobacco Research and Intervention. This is the region that I cover. You can see that I have a large chunk of Wisconsin. So actually the hour-and-a-half drive from Eau Claire today seemed pretty short, which was nice. How many of you in the room fall within my region, if you can see the map? Good, so a good chunk of you. And then I'm guessing probably the rest of you fall within the northeastern region. So if you do fall in that northeastern region, Roger Dyer would be your contact, and I can get you his information if you'd like. So today I'm going to talk about some different resources that are available to help youth quit e-cigarettes. As we heard earlier that this is something that we still don't have a lot on. One of those reasons is because it's so difficult to do research with youth. And the other issue is that these products are so quickly evolving and changing. By the time you do research on one, there's already 2 new products out there on the market, and they're all very different. And I also just wanted to make the comment before I really dive into is the difference that we see when talking about these products in regards to adults versus in regards to youth. What we know is that youth 100% should never ever be using these products. We know that nicotine is harmful for the developing brain. There is an ongoing debate in the nicotine community on whether or not these products would work as a cessation device for adults, and the answer is we really don't know the answer to that yet. So that's just what I wanted to touch on first. But with that, I'm going to dive into the first resource I want to talk about, which is the Wisconsin Tobacco Quit Line. How many of you are familiar with the Quit Line already by a show of hands? Good, a lot of you. So a lot of times when people think about the Quit Line, they don't think about it as serving youth or people who are addicted to other nicotine products, when in fact the Quit Line can serve anybody who is 13 years and older. And this program is available 24 hours a day, 7 days a week, and they provide free confidential telephone counseling to anybody who calls in. So these are the services that the Quit Line offers. The first are those Quit Coach calls. So anytime somebody calls the Quit Line, they're speaking to a real-life, actual person. And all of these Quit Coaches have 4-year degrees. Many even have advanced degrees, and they all receive extensive and ongoing training, which really helps them provide that individualized, tailored counseling to every single person. And they do receive training in how to speak with youth as well. The other feature that the Quit Line offers is a free 2-week supply of nicotine replacement therapy. But in order to receive this, you must be 18 years and older. And yesterday we did receive a question about, is it something that youth can use to help them quit e-cigarettes? And so the answer is that the clinical practice guideline for treating tobacco use independence does not recommend the use of nicotine replacement therapies to those who are under 18 years. And that is because we know the effects that nicotine has on a developing brain. However, I have heard of instances where a parent takes their child to their physician and they decide that the risk of that child continuing to use an e-cigarette is greater than if they were to use the nicotine replacement therapy to wean off of it. So that may be an option for a parent and their child to decide with their healthcare provider. The other service that the Quit Line offers is that they now have an online web coach feature. So I know most youth today aren't the biggest fans of having to pick up the phone and actually talk to somebody. So this might be a way for them to access the Quit Line a little bit more readily. They can create a username and password where they can log on to a computer or their phone where they can chat with other quit coaches. They can chat with other people who are trying to quit tobacco products. They can build and track quit plans on this website. So it's just another really great platform to access the Quit Line services. And then finally, what the Quit line will also do, if it's something that they're interested in, is mail out a Quit kit. And this is made up of different printed materials, like some basic information on nicotine addiction, as well as how to manage some of those cravings and withdrawal symptoms they may be experiencing. And these materials are designed for different demographics, so they do have materials specifically designed for youth. Switching gears, I am now going to talk about a couple new mobile apps and texting programs that are available to assist youth. So this first one is fairly new. It's called This Is Quitting. This is an app designed by the Truth Initiative along with Mayo Clinic. All of the advice that this app offers is clinically sound. It's based in some of those recommended counseling techniques. But what this app does is it pulls in all of the different tweets that are being put out on Twitter about trying to quit Juul or wanting to quit Juul. And so it piles them into one nice feed. So if you are trying to quit, you can go on there and see what other people are going through, and you can see that there are other people trying to quit and offering advice. It also offers different training challenges. And again, this is really designed to target the youth of today. For example, one of the challenges is called Netflix and Quit. I don't know if you're familiar with the popular saying Netflix and chill. So they're trying to go off of that. This device also provides a link to the Quit line, and then it also will offer information on some of those different FDA-approved cessation medications if that is something that they would be interested in. This Is Quitting also has a text program that is meant to be used alongside of the app. In fact, one of the first challenges within the app is to sign up for this texting program. So it delivers these different tailored text messages throughout the day. In fact, I just signed up for it to see what it was like, and I was getting text messages at 10 o'clock last night asking me if I made it through the day Juul-free or not. So it's really interesting if you want to check it out. They also have a separate line designed for parents where parents can receive texts to assist their youth in quitting. The second app that I want to talk about is called Quit Start mobile app, and this was an app designed by the National Cancer Institute along with the FDA. This app was designed with in mind with helping youth quit cigarettes. However, I feel like a lot of the same principles can be applied to somebody who is trying to quit e-cigarettes. Again, this is an app that I have downloaded on my phone. Sometimes it's fun just to see what these apps look like and play around with them. But it has all different types of challenges and basic information on how they can quit. It helps them prepare to quit, monitor their progress, manage cravings and bad moods in healthy ways, and also distract from cravings from games with challenges. They have ways that you can share your progress on social media. And it's designed really well where there's a couple different buttons. So if you're having a craving, you press that button, it brings up different ideas of how you can get through that. If you need a distraction, you hit that button and it brings up all of these different games. So it's a really nicely designed resource. And the last one I want to talk about is smoke-free text or dip-free text for teens. And so this is similar to the This Is Quitting text program where you sign up and you can receive different tailored text messages throughout the day. It's going to provide you with advice and challenges trying to keep you from being smoke-free. It's designed for ages 13 through 19, and it's usually a 6 to 8 week program. There's also options where if you're having a craving, you can type in the keyword crave, or if you slipped and relapsed, you can type in slip, and they'll send you some messages to get you back on track. And then finally, I just wanted to leave you with a few other really great resources that you can turn to if you're looking for more information. The Truth Initiative, as you've heard many times today, is a wonderful resource to turn to. Also, as Spencer talked about, Tobacco is Changing is a great place to start just to learn more. Also, The Real Cost. This is a campaign by the FDA. We saw some of their ads. And then finally, Smoke-Free Teen is another great place to turn. So that is all that I have for you guys today. Did you have any questions before we get into the Q&A panel? Yeah. Yep, 47848. And I forgot to mention too, I brought a bunch of different Quitline materials. I brought some bookmarks, postcards, and business cards, and you can find them on the table out there next to the tobacco is changing materials. Great, well, thank you guys.
All right, thank you for that. There's a lot of really great resources. That's awesome. Now it's time for Q&A. So Jenna, Carleigh, and Jackie and Kayelyn, if you could join us up here. And as our panelists get seated, you've heard from all of them earlier today, and now you'll have the chance to ask them questions. So I'm going to ask the panelists to reintroduce themselves and explain their role and what they do, and then we have about 30 minutes for questions. Come on up. Okay, so do you need one more?
Hi, my name is Kayelyn Schulze. I'm a junior at Lincoln High School and part of the FACT Club.
Hi, I'm Jacqueline C. I'm currently a junior and the president of the FACT Club.
Hello, my name is Alex Peeters, and I am the Northwestern Regional Outreach Specialist at the W Center for Tobacco Research and Intervention, and I provide training and technical assistance to healthcare providers on helping them help their patients quit smoking.
Hi again, I'm Jenna Flynn. I'm a health educator for Marathon County Health Department, and my primary role is to coordinate the Central Wisconsin Tobacco-Free Coalition, which serves Marathon, Wood, and Portage counties.
Hello, everybody. Carleigh Olson, Policy Coordinator with the Tobacco Prevention and Control Program and the Pop Health Institute. I provide technical assistance to local coalitions and networks, and any other questions on policy stuff, I try to get that answered.
Thank you, panelists. I just want to make a note, our students have to leave early today, so if you see them sneak off the stage and exit, you have permission. They have permission slips for this.
And then I just want to make just one request. If you do have a question, just wait until Kaylee or I get to you so you can speak into the microphone so that whoever's watching on WisconsinEye can hear you. Thank you.
Yep. And so Kaylee and Megan are out there. Just raise your hand if you have questions and they'll come get you. Okay, do we have a first question out there?
I have a question about the FACT group. Did somebody from a coalition approach you to start the group, or how did you guys start? How did that happen?
Well, the FACT group was started before I came to the FACT group. My sister, Adeline, she was the one that encouraged me to join, and I believe she did start one for Lincoln High School. So that's how we became a group at Lincoln.
Chris, not to put you on the spot, but would you like to speak more about that? Do you know more? Okay.
Chris Bondioli, I'm an advisor for the FACT group at Lincoln. The history of the FACT group, it actually was I worked at a junior high school before the high school, and FACT started with Luke Witkowski approaching, some of you might know Luke, but he approached one of our school counselors at the middle school at the time, and then when we had a transition where we shifted grades, I inherited the FACT group at the junior high school, and we've had it all along since. And what Jackie was referring to with her sister, Adeline started it up at Lincoln High School when I was still at the junior high, and now I've kind of joined forces. Now we're finally all together on the same page. So I don't know the origins when it was at the middle school, what Luke did to begin that with Gretchen, who was the counselor at the time. I just know that it started there, and we just kind of inherited it and been running with it ever since. So I know we're the only FACT group in that 3-county with Wood Marathon and Portage County. districts. I think if other schools wanted to start it, it would be having an advisor at that school and maybe reaching out to someone in a coalition and try to get that developed, and maybe reaching out to FACT. Renee, I know, is here too. Maybe you can comment on some things, Renee, too, about the origins and beginnings. Okay, let's give the microphone back.
So, it's loud. I'm Renee Wadzinski, and I manage FACT. I'm here with Kim Bestel, and she also coordinates the program with me. So we work at the American Lung Association, and we provide training and technical assistance to all of the FACT groups throughout the state. There's about 30 right now of other groups of cool kids like them. And they all do tobacco prevention work. They're all youth advocates in their communities. And so FACT is a part of the work that the coalitions do throughout the state. So all the other Jennas throughout the state, there's like 15 other Jennas throughout the state that have their clusters of counties. Each of them has a work plan with the state. They receive their funding from the state's tobacco prevention and control program, over at the state health department. So the coalitions get their funding from there, and then the coalition has a work plan. They do lots of, fun stuff that Jenna probably talked about earlier before I got here, but lots of important tobacco prevention and control work with adults. And then FACT is their youth branch, basically. FACT is a pretty decent chunk of their work plan and their scope of work that they do throughout the year. So that's basically how FACT groups exist now. There was a time where, like when Chris was talking before, FACT groups run the work plans with the coalitions. FACT kind of existed on its own, and then it was kind of a little more nebulous, I guess. But now one of the advantages with them being tied to the work that the coalitions do is that we can really leverage the infrastructure that already exists with the tobacco-free coalitions throughout the state. And then they have a lot of knowledge of what's going on in their local communities and what their needs are. And they manage, the FACT groups locally. So then they get people like Chris who are advisors for the groups. And then the groups are really well positioned to do a lot of work on their own and make decisions about the kinds of messaging that they may think that their peers need locally. They get to decide the types of factivisms or advocacy activities that they're doing. And they provide a lot of great guidance to all the adults involved regarding, the types of products and problems and issues that really need to be addressed, because we don't really know that stuff. Like, even if you're working in a school, it's really hard to know what young people need and what the issues are. So that's one of the reasons why the FACT groups have become so crucial to the movement, is that we really do need to have the young people involved, and we need to hear from them about what these issues are. So that's sort of how FACT groups look now. Yeah.
For the Lincoln students, I'm just curious on this 2-person per bathroom situation you guys got going on over there at Lincoln. How does that work? Who's monitoring that situation, and how did that come about? Like, how did that trickle down?
So it's quite interesting. As the police liaison said before, the bathrooms are a pretty hot spot for smoking, and as a result, the school decided that they were going to put a rule on, even though there's 10 stalls in the bathroom, only 2 or 3 people are allowed to go at a time. And I don't know if you guys have been in a lunch cafeteria during school recently. Kind of hectic. A lot of people go to the bathroom. So it's kind of frustrated and angered the other people at the fact that there's a line of maybe 12 girls, because we like to travel in groups, or guys waiting outside the bathroom, and only 2 of us can go at a time. And me and Jackie, one lunch, were actually late to our class because we were waiting in line for lunch. So it's kind of, it's a little frustrating at times.
Also, I think it's really mainly just because when people vape or Juul, they like to do it in a group. So especially so we have one bigger stall in the bathroom for handicapped. And so I think this is why they only limit it to around 2 people, because they don't want a big group of girls going in there again, or boys, to vape or smoke or Juul in the bathrooms. So just to reduce that.
I have a fun question. I'll declare it fun, I guess. For each of the panelists, what's the most shocking flavor that you've seen, or what was your first reaction when you saw some of the different flavors that these came in?
I think the most shocking flavor is, I think there's a flavor out there like unicorn poop or something. I don't know about you, but that does not sound too appetizing.
I just think like how they have common flavors like mint can be really camouflaged into like gum as well. So some people might not be able to suspect that it's actually from a jewel or something and might think it's just from chewing gum.
For me, some of the most shocking ones are the ones that look exactly like other products that are already out there on the market, like ones that look like, there's one that looks just like an apple juice box, and I think it's called Watts instead of Mott's. So to me, those are some of the more shocking flavors.
And I think I'll just add to what Alex said, you know, as someone who produces applesauce or juice boxes, I would be kind of appalled that e-cigarette companies are taking advantage of their marketing strategies and using them for their benefit. But personally, I had a gathering a few weeks ago where there was actually a table that had leftover food on it and things, and there was a container of vape juice on that table, and everybody left. So I grabbed it for my presentations, and it was strawberry pomegranate. And I took a whiff, and it smelled delicious. So it's not a coincidence. But yeah, it's very intentional. So great question.
I guess for me, I always find it interesting how they're kind of similar to what Jackie was saying, but kind of also those just pretty standard flavors. So like there's a tobacco flavor or there's mint, right? So there's like the two extremes. So, you know, mimicking what, you know, might be a more traditional flavor versus like unicorn poop, right? So just kind of interesting.
I have a question for Alex. In thinking about this non-punitive for children or kids who vape or smoke or whatever in the school system, would the resources that you provided with the Quit Line, would a school be able to tap into those resources to help kids? And I'm thinking about schools in a very rural population that don't have resources for counseling and therapies and treatments.
Yeah, absolutely. The great thing about the Wisconsin Tobacco Quit Line is it's a 100% free resource, and there's no limit on the number of times you can call in. So it's definitely a great program to utilize, because when they call that, they're going to be speaking to somebody who's been trained to, in that behavioral counseling to help them get off of that product. So this is definitely something that'd be really useful for those rural communities to take advantage of. And then those other apps that I talked about, those are all free too. So just knowing that those are out there and maybe having the counselor or whoever is working with these kids have them handy on their phone to show them, or even pull them up and help them download them so that they have them there.
This is for Alex again. Do you have a list of all the resources in one place rather than me trying to write them down or pick?
Yeah, I can get those to you. And Jenna also has a really great flyer that lists, I think, all of the ones that I talked about. Do you have that handy?
At our coalition table outside, there are those flyers. Okay. And then if you visit the Central Wisconsin Tobacco Free Coalition website, there's a flyer embedded in that too.
I would just add, there are some free curriculums that you all can look into. I could not rattle them off the top of my head, but we also have a list of those and would be happy to get them to you.
I'm going to ask for a magic bullet here. We all talk about root causes as part of why addictions happen. Are there any best practices that school districts, given their limited resources and their mandate is really to educate beyond addiction? What do you need as young people to help you make the next best right choice? Is that opportunities to gather and just learn, or more group counseling, or what?
I believe that I think mainly just like support, having a supportive environment would really help with that as well. And maybe like if you don't like force like for consequences, like just giving them an option, sometimes for people they won't take that. I feel like maybe kind of like forcing them to like do rehab or something like that would probably be more effective in doing this.
Just to add, I just think information is key. Getting it out there to your students, and hearing it from a peer might be better than hearing it from adults. But, you know, kids constantly ask the question, why? Like, you know, we're told don't smoke, don't do this, it's bad. But then kids come back and we always say, but why? And I think information and explaining to them, well, this is why, you know, it causes all these different health problems. And then it's a pathway to better understanding, okay, this is not good for me, so that's why I shouldn't do it. So I think information is definitely power in this situation, and one of the key things that I would definitely say.
I'll just add to, you know, if you're thinking about locally, maybe you don't have a FACT group in your district or in your county even. If some of those student orgs in the districts already work to address substance abuse and misuse, perhaps focus on even political science or youth advocacy, leadership groups. I know the one in Marshfield, I'm gonna butcher it, Catholic Columbus Leadership Alliance, is that right, Kaylee?
Marshfield and Columbus Leadership Alliance.
Thank
You were
you.
close.
So they're, you know, that group is not fact specific, but they are taking a stance and have done some presentations around vaping. So I would maybe tap into some of those groups too. And if there's a group, a student-led group interested in addressing this, and there's an advisor that's, you know, putting in the time to do it, those are probably good resources too, because as the student said, you know, hearing peer-to-peer is probably the best way to go with this.
Question for Carleigh. If schools are interested in expanding their tobacco-free policy to include e-cigarettes, where can they go to find the kind of language that they should use, or how should they start that process?
Yeah, so on our website, tobwis.org, I'm not sure if it's been up there yet today, but we have a comprehensive tobacco-free schools page where we have a lot of different resources, including the model policy language. There's also a checklist on there that we created that basically helps you if you want to go to your district policy and look at your district policy. You can take that and put it side by side with that checklist, and it helps you kind of walk through where there might be gaps. And, you know, ask certain questions that align with the model policy language. So, you know, maybe you're walking through it and you're like, oh, wow, you know, there's a huge gap in it not covering e-cigarettes or something like that. So it can help identify where you might be able to strengthen that policy. You also can reach out to me. I'm happy to give you my contact info, or, you know, Jenna can direct you that way too. So we all can support you getting that information. Yeah, it's tobwis.org, TOWWIS.org. And that really is just a resource hub that we use within the tobacco prevention and control movement. It's for people doing the work, not necessarily as a website for like, you know, we don't necessarily direct it to, if my mom had questions, I wouldn't have her go to TOBWIS. It's just mostly a place to store lots of resources and fact sheets and things like that. So just so you know kind of the lens of what that looks to reach.
I have a question for anyone and everyone on the panel. Where do you see the tobacco industry in 5 to 10 years from now, if you had to predict?
Okay, so I can start. So 5 to 10 years from now, I mean, I think that they'll continue to work on e-cigarettes, right? They'll continue to market them. I'll be curious to see what happens with advertising policy and see what kind of evolves with that, with our new age social media advertising and how that's been an opportunity to, you know, get a new market, right? So that'll be interesting. I also think that something we can't really ignore, and it's come up a little bit today, but you know, the tobacco industry is very deeply intertwined already with the marijuana industry. And there are some very clear connections to, you know, those two industries, and most explicitly we see it with the industry buying into marijuana in Canada most recently. So, you know, I think that that will become even more intertwined.
I like to use analogies. So a tiger doesn't change its stripes, but a chameleon will change its colors. So the tobacco industry is a chameleon, really. You know, even back in the day, how many of you were around when smoking was still allowed in restaurants? Yeah, so a lot of us. So it's evolving. And as Carleigh said, the tobacco industry is very smart, very clever. They have a lot of money. Before the FDA addressed the youth surge in e-cigarettes, the e-cigarette companies were specifically marketing to youth. So since then, they've switched their tactics more towards adults. However, there is now millions of users addicted to nicotine. So I don't see it changing a lot. I just see it evolving.
Yeah, kind of just to echo what Carleigh and Jenna said, is that they're going to continue to evolve, and we're seeing this right now. We're seeing some of the biggest tobacco players are now buying into that e-cigarette market just under the guise of a different product. And they continue to come out with new products. The newest one coming is a device called IQOS, which actually heats up a tobacco product rather than burning it. So just continuing to watch out for the new products that they're putting out there under the facade of a different type of product.
Yeah, I would say the same thing also, just coming up with new products like the Juul and stuff, and probably coming up with different tactics to somehow get youth involved even more in these products as well.
I would probably just reiterate what the other panelists said. They're going to constantly go after where they can make money, and they're going to change their products so that they can make the most money. And I think it's just being proactive and trying to stop it before it becomes a problem. And I think hopefully we can get in front of this and stop it, but they'll constantly, you know, try to change so that they can make as much money as possible, whether that's targeting teens or adults. You know, it's just a giant force that will not stop, but they'll do their best, and all we can do is stop them in their tracks.
This is not a question, just kind of an add-on with that, is that I think it's going to be really important that we not buy in and make sure other people don't buy in, because I think that what they'll continue to build is a narrative that they're in the business of helping people use safer products. And so I think that they're already sort of using that that talking point, that messaging frame. So I think it's going to be really important that we really stayed vigilant. They're going to try to portray themselves, I think, as the good guys, you know, moving forward, and that they're a partner in this effort. And I think it's really clear to always be ready to call them out, because they're not going to stop selling cigarettes, you know, as much as they'll start experimenting with new products and things like that. That's still their bread and butter. So I think just being really clear on that they're not part of the solution is something to keep in mind.
I have kind of a sort of an add-on to that, but then also a question for Alex Peeters. Have you seen that Juul-funded study regarding their, like the Juul being ineffective and like for quitting, a quitting aid. One of my colleagues kind of alerted it to me like a couple weeks ago, but I hadn't had a chance to dive into it and actually like read it. But are you guys like aware of it, looking at it, seeing what they're saying?
I haven't personally seen that study, but I have been seeing all of the requests that Jewel has been making, reaching out to all of the people in the community who study the effects of cigarettes. I know they have approached our director wanting to sit down and meet with him, and of course that the standard is that we don't ever want to work with the tobacco companies because we know their history of funding research that's not accurate, but that's just like out of the playbook of Big Tobacco. They did the same thing. They funded their own study saying that cigarettes were necessary for people coping with mental illnesses to recover. So it doesn't surprise me that they're doing that, but I'll definitely have to take a look at that.
I just want to add on to, we talked about this a little bit yesterday, so maybe someone said it earlier, but you know, the e-cigarette manufacturers have never once tried to go through the routine processes of FDA to make it a cessation product. It's always been on the track to be a tobacco product. So this narrative around it being a cessation alternative is not really what they've been doing in order to be in the market. So I think that's just an important lens to consider when that messaging point is used.
This is not a question, and I'm just building off of what Spencer said. I think one of the eye-opening things for me with this is the way this industry is promoting dishonesty in youth, and by masking these products so they look like something else, to promote hiding it from their parents. I just, that's so underhanded and just so very dishonest.
Hey, so I just had a question about, I know Juul's changed their on-TV advertising a lot in the past year, at least, and like, I was wondering if you think that will help at all, or if that's just a tactic to try and, I don't know, persuade the FDA to not be as harsh on them in the future. And then also going forward, is there any way to combat sort of the people who promote juuling and vaping on YouTube and stuff on social media who don't get paid for it, but they're making these videos that are watched by millions, like how to hide your vape from your parents or how to vape in school, stuff like that? Is there anything, or any ideas, I guess, on how to combat that aspect of it?
I gotta gather my thoughts. That was a lot. So in terms of, I hope I answered your question correctly. So the question was related to some of the new advertisements. How many of you have seen the new Juul commercials on TV? It looks very similar to the Tips from Former Smokers campaign, the same setup where people say, I used to smoke and now I've switched to Juul. That to me is quite despicable. For people who are truly addicted to a product and they want to switch to something that might be healthier for them, Juul really isn't the answer. We have FDA-approved medications that are out there, and Juul is not on that list. So it's a bummer. I know we mostly focused on youth prevention, but the fact that this is how this is being promoted to adults now, and you have adults going into these stores saying, hey, I really want to quit tobacco. What did I say at the beginning of the presentation this morning? The products are not harmless. So that is one of the main talking points that we're supposed to leave with today, right? So I'll speak to that part. I'll let you guys chime
in. You know, I think that we have seen a really clear shift in how they talk about their product, right? And to me, like, I think the clear shift has more alerted me to be paying attention to how they're messaging and talking about it. Taking a step back and looking at it, it really kind of just feels like noise when we know what the issue is that our youth are using them at an alarming rate. I was on a webinar, and don't quote me for the exact data, but they were saying how you know, this is the fastest growing youth substance use of any product in the history of tracking all products, like meth, opioids, all of these, fastest growing. And that's alarming. And so while obviously as an industry they're going to position themselves to shift their talking points so that they can stay in the game, I think that we have to stay in our lane and realize what it's doing, right? So I guess that would be kind of my thought. It just feels like noise.
And I'll just make a comment too. I was at a conference a few weeks ago at Mayo Clinic and got the chance to hear some of their scientists speak on this. And they talked a little bit about the difference of vaping in the US versus the vaping in the UK. And the UK has a very different lens on e-cigarette use. There, almost all of their physicians will tell their smoking patients that you should absolutely switch to an e-cigarette, which for us was really shocking because we know that we don't have enough data to make that recommendation. And the other thing that's really interesting too is that their youth vaping rates are much, much lower. They do not see the same trends that we do here in the US. I think that their vaping rates were somewhere around 2%, and that's because they weren't marketed the same way they were here. Because the FDA was a little bit slow to crack down on Juul, and because of Juul just blew up so quickly, it was hard to get a handle on it, and that just didn't happen in the UK. So that's one of the reasons too why we see much higher rates here in the US.
Did you have a second part to that question? Did we answer that? Okay.
Did they say why they, at your conference, why they recommended, like, was their reasoning?
Sure. So this is a huge debate within the scientific community who's studying e-cigarettes, and there's really two camps. There's those who think that, yes, we should 100% be pushing our adult smokers to use these products, and the other camp that's saying, no, we don't know that this is best practice, and we don't know what the long-term health effects are. For adult smokers, what we do know is that these products are probably less harmful than smoking a traditional combustible cigarette. And so that is why their providers are pushing their patients to use these, because we know cigarettes have those 4,000 chemicals and 50 known carcinogens, whereas e-cigarettes have much lower levels of those. So that is one reason why that they're doing that.
Do cigarette smokers get popcorn lung, like the vaping?
So what causes popcorn lung is actually a specific flavoring found in some e-juices. It's caused by a chemical called diacetyl, and it's that specific chemical. It's called popcorn lung because of this is a chemical that's used in the flavoring of microwave popcorn, and this flavor or this chemical is safe when you ingest it. However, when it's turned into an aerosol and you breathe it in, it changes that chemical, and it's called popcorn lung because this phenomenon, popcorn lung, was first seen in those popcorn factory workers where that diacetyl chemical was being turned into an aerosol and they were inhaling it. So it was really interesting when they started seeing this happen in e-cigarette users who were using popcorn-flavored e-juice. So that is why we see popcorn lung only in that specific e-cigarette flavoring of people who use it.
What about I heard that kids were getting like mouth sores and all kinds of respiratory infections and heart problems that they weren't seeing. They were seeing it in like people who are like 50, 60 years old, and there's like teenagers or 18, 19, 20-year-olds. If they would put that kind of information out for kids to understand and see those kind of health effects that could affect them, maybe that would help stop them from using these products.
Yeah, we, at the session yesterday, we talked a little bit about that, and the really great high school student we had speak had some different perspectives, and she said that those immediate consequences are the ones that speak most strongly to young people. So perhaps that they could get those mouth sores. But the other thing that she mentioned that was very effective in talking to her peers about this is the cost. If you break down how much money they're spending in a month, if they're using one pot a day, that adds up very quickly. And if you can break that down and show them that, that you're spending this much money a month. Do you think that there's any other ways that you could be better using that money that can be a really eye-opening experience for young people too?
We got to figure something out.
Yeah.
I'm going to ask a question of our two students here today, and it was asked yesterday. What do you think parents and school personnel can do to reduce the initiation rates of e-cigarette use by your peers and or help students quit? We're interested to hear your perspective on what should be done by the adults.
I think mainly just having a good relationship with your kids or just like anyone. I think that would get them to be more open about potentially what might be happening.
So I think it's a balance between, trying to support your kid and consequences. Growing up, my parents always taught me that there are consequences for your actions. And I think especially when kids are being found with jewels and everything at school, I feel like you need that good balance between we're here to support you and help you get better. And if you're addicted, we want to beat it and we want you to become, jewel-free and everything. But I think it's also teaching them that this is the consequence though, because this is not okay. And I think for parents and kids, you don't want to share everything with your parents, but like Jackie said, I totally agree. It's just having that, conversation with your kid, not necessarily coming out and, pointing that finger, but, acting as someone who just is there to support you, no matter whether or not you're using it. If you're using it, we want to get better. If you're not, great. Well, let's keep it that way. So I think it's definitely just that healthy balance between consequence and support and just being very open with your parents.
Hi, I'm wondering if you have any updates regarding some of the bans that the FDA proposed a few months ago regarding flavoring or even restricting sales at like convenience stores. I haven't heard anything about it recently, so. Sorry.
I might lean on Spencer a little bit too if he knows more. He's shaking his head no. I personally don't have any updates other than what you probably have seen. I think with the old FDA commissioner, his name is slipping me right now, leaving and then having a new person come in, he has really been, one of the champions of lifting up this issue when he was in his tenure there. So I think that, we'll have to see how fast things move. I think history has shown us that federal level policy doesn't move very fast. So I think we'd all love to see it go a little bit faster, but no major updates. Yeah, Spencer said he just doesn't know the dates off the top of his head.
We have plenty of time for questions still. Other questions?
This isn't so much a question as a statement that I did a full cost breakdown of like jewel pack per day, pod per day versus traditional cigarettes. So I have all those numbers. So I don't know if you guys would like me to make that available to you and you can send it out, but I just wanted to throw it out there that I've done the work. If anybody would like to use it, I am happy to share.
Yeah. You can send it to one of us and we'll distribute it to the attendees of both sessions.
Let's give another big round of applause to our FAC group before they leave.
Thank you, guys.
I have another question for the panelists. What are the most critical changes that we must make to face the future effectively, in your opinion? If you had to pick one or two.
Well, coming from my perspective in more of the healthcare realm and research is just really nailing down what the effects of these e-cigarettes are and what the long-term effects are. I think that's going to be critical in, especially with these companies continuing to make claims that they're a cessation device. So really flushing out that research and getting a clear understanding on exactly what these products are doing and if they are in fact a cessation device.
I would say I have to go with education. I mean, reaching out to the people who do have the ability to affect change in our communities. Earlier this year, our coalition met with Senator Patrick Testin, who's also the chair of the Health and Human Services Committee for the state of Wisconsin. He was very receptive to the information that we shared with him, and he also admitted that he didn't know all of the information we were sharing in terms of flavors and placement of products and things like that. So if you have the opportunity to meet with those people, to provide them the education and be a resource to them, that is really important.
I think for me, I would say thinking more like on a system, like a systems level. Obviously, e-cigarettes, and this is why we're here, right? It's a huge problem. But how do we set ourselves up for 20 years from now not falling down the same trap? And, so we're not always being kind of this reactionary model. I think speaking from a public health perspective, when I got into public health, I really wanted to work on the preventative side, right? And really true prevention happens long before you've even gotten in this room, right? We're here because there's a problem. And wouldn't it be nice to just not be here? So, I think about how awesome it would be to work myself out of a job. I don't know what I would do, but, I think trying to think about on a systems level, how do we set ourselves up for attacking the root cause of some of these issues versus, downstream, now we're dealing with it. And I realize that's not very specific, but I guess I just encourage us all to step back and realize that addiction comes in many forms and it's not just this one issue. I think there are many ways to think about how we do that differently. But that would be my non-specific answer.
On that note, we had a little talk about this at lunch, and addiction is probably what fuels this vaping problem and the nicotine, but we were talking about how ACEs and people with all the traumas, and why do you pick up a cigarette? Why do you pick up a vape? Any kind of substance like that. It's because people they have like problems at home. The kids are talking about having a good relationship with your parent. Well, there's a lot of kids that don't have that, and they don't have anything. So that's why we kind of like to involve the schools, because that might be their only stable place in the daytime. Or, we're all a bunch of adults in here. If we see kids that are needing help, or if you see other people that need support or whatever, it's kind of about stepping outside of your comfort zone and asking someone if they need help. That's where I think prevention starts, is looking at the other people and saying, okay, why are you doing this in the first place? So if we all start looking at it that way, we might be able to get around the problem. Because for a long time, nobody was looking at those issues. And now everybody's looking at the addiction issue. So maybe if we keep on that path, we'll get somewhere, and you might be out of a job, but I don't know, not for a while.
Yeah, one of my favorite exercises to do, and it's a little bit simple, but it's called the 5 whys, and maybe you've heard of it, but taking an issue and asking yourself why. Well, why does this issue exist? And then you come up with a new answer. Ask yourself, well, why does that issue exist? You come up with a new answer, and you get to 5 whys, and you usually end up at the root cause, right? And that's really what's going on. And I think it's really served as a really nice tool for me in thinking about some of the things that are, below the tip of the iceberg. Right. So
I think something else I'd like to add, this is kind of related since you brought up, who's dealing with substance abuse issues and trauma and things like that. Officer Frank pointed out in the beginning of his presentation this morning that this vaping issue is non-prejudicial right now. It's not right now. But if we know historically how big tobacco works and how these industries adapt, who do you think they're going to be targeting after the dust settles? It's not going to be a surprise when they start targeting low-income, Native American populations, those with mental illnesses, because they did the same thing 10, 20 years ago.
And I just wanted to add too, right now in the proposed budget, there is a line carved out for addressing tobacco use and ACEs. So that is being recognized as a big issue.
Any other questions? Okay, I think we're quiet. Well, we're a few minutes ahead of schedule. Thank you very much, panelists, for all that wonderful information. We're scheduled for a break right now, so we'll take 15 minutes and we'll come back at 5 after 2 for a mad tea party. So if you haven't done that before, it's super fun. Oh, there's snacks. So I'm curious, yeah. Yay, snacks.